My my network is a little chaotic. So how is your preparation going? Start recording, Guru.
Started, madam, started.
Okay. ठीक है. I am actually in a village and that was the issue. Morning network was a huge issue.
Acha.
So how is your preparation going? How well prepared are you guys?
Don't know, madam.
Don't know.
So that is where is the first tip actually. Don't think you're not prepared. You guys know much more than those white people sitting there. Trust me. What's the Guru?
Yes, yes, madam. Definitely. But they
Guys,
want us to
we
talk
have
in their lines.
yes. All they want is that you talk in the way they want. Okay. So the biggest mistake, most of the people who have taken mocks with me will know this. The biggest mistake that we do is we speak very fast. Our English and their English is way different. So we need to have their way of speaking in the language part first. Okay. We have to speak slow, especially those people who come from Sweden and French people. I mean, understanding their language is a challenge, and for them, understanding our language is a challenge. We speak so fast, we will say, for instance, when they ask us what is the treatment for rhabdomyolysis, we will go like, we will hydrate, we will give this, no, 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 no. So they will catch only 1 or 2 points out of it. So you need to know कि examiner कैसे mark करता है. The very purpose of having so many mock tests, so many practice tests was to tell you the pointers where they will mark you. Okay. And the initial practice mock tests that are there, the first 3 or 4, they have been made in coordination with one of the examiners of the EDIC. Okay, one of them who was there, I somehow happened to take his help, which was the initial days. Okay. So they have been actually made with the pointers and basic, keeping those pointers in mind, the rest of the pointers have been made. Okay. So, and even if you look at your practice mocks, which the EDIC people conduct, they have the pointers in the similar manner. Okay. Ankur, whoever must have attended may have an idea about this. Okay. So this is how it is. You have to understand what they are asking. You have to understand what they are going to mark and try to stress on those points. Don't keep on repeating points because your time is very limited. Okay. If you don't understand the question, if you absolutely know nothing about a case in a CBS, skip it. But in CCS, utter something because you will never be able to come back on that question and there is no negative marking. Okay. So when you when there's a CCS question or there's a case scenario, first is start making that patient in your mind. Start visualizing that patient in your mind. Okay. Start seeing that such a patient is lying on the bed in your mind and on your tape in front of you. You are in the ICU. You're the boss of that ICU, and there is a patient lying there, and you have to now manage it. You have to instruct everybody to manage it, and the people whom you are instructing know nothing. So you have to instruct them from putting an IV line. They are not going to even move a bit if you don't instruct them. They are robots and they will do only what you tell them. So you have to tell them every little thing that, put an IV line. Of course, they will know the steps of putting an IV line. Don't stress on that. So the robots need clear instructions on what they need to do. Okay, you need to give fluid at this rate. You need to intubate with this. Before intubation, you need to keep these things ready. Nothing is to be assumed for them. Okay. Whenever you get a vignette one, the
Once
vignette one,
you see once you see the first vignette, commonly they will ask two things. One is how you will start managing one, or what is your not diagnosis, your differentials. So that is a common two things they ask. That you have to be ready in your mind. Okay, you can keep write it in a piece of paper and just this one. And if time permits in that initial 5 to 10 minutes, most of the cases, because your practice mocks and all, they will go in one line or the other line. Either they will take a kidney line or a liver or brain. So that flow you practice otherwise also in the next 2-3 days. It will be just linked. For example, if it is a blood transfusion, then there may be massive transfusion. So transfusion related complications, and then they will go for abdominal compartment syndrome. From there, they will start going into that. It's like a chain of events. Okay, there's nothing new. Everything you will be knowing, but If you anticipate, it is well and good. I am done.
Then, as he said, the first minute when you get, you have to think like an examiner, वो मुझे क्या पूछने वाला है? Okay, what is the questions that he will frame? First minute questions invariably will be, what are your differentials? What will you do next? How will you investigate next? What is your interpretation of the investigations which are given? So they may ask you interpretation of the ABG, X-ray, CT scan, or whatever they are giving. Okay, they will invariably, so be ready with those answers. Those answers, the first minute questions, you cannot waste time. Your answers have to be at the tip of your tongue and in a proper structured manner. Okay, you'll give a good first impression to them. So they may even help you out in the further minutes. So your first impression has to be a sixer. Okay, the first ball you have to hit it really well. Okay, most often there are questions, there are very good simple questions like how will you interpret? So interpret may you have to mention every points. ECG may give the rate, rhythm, everything. ABG may give a complete conclusion. वहां पे calculate करने मत बैठो कि whether it is a higher NAND gap or lower NAND gap. They give you a ABG 10 minutes prior. They are expecting you to be ready with that answer. Okay, they tell them what it is in one single line. This is this khatam. Okay, then they will ask you how will you intubate the patient. ये invariably question आता है. And when they ask you this question, how will you interpret, you should have the some pointers in hand. Every patient in the ICU is going to be a difficult intubation. So you have to say, I will anticipate difficult intubation. I will keep HELP, difficult airway card standby. Okay, if they give you some allergies related, mention about those allergies. You can mention if there is some position which is to be avoided, you can avoid that. If they give you a obese position patient, you can say, I will use a sniff position. Every patient in the ICU will undergo a rapid sequence intubation, and do mention video laryngoscope, because nowadays video laryngoscope is the way of treatment in the European countries. We don't use it in India, but they use a video laryngoscope almost for every patient. So do mention video
Just
laryngoscope.
mention that
Okay.
because the patient is
For it,
critically ill, the patient has got low threshold for hypoxemia, and a good oxygen pre-oxygenation is very much needed before you intubate.
yes. Yeah. Next point is pre-oxygenation. Mention about low apnea time that it may give you. You may even mention about giving oxygen while through prongs while intubation. That should be one point. Okay. And after intubation, ETCO2 is one point which you should mention. So intubation में ये 5-6 point आने चाहिए. Okay, we just mentioned 1 or 2 points, so we lose 4-5 marks there. Okay, induction should always be cardio stable. What precautions you have to take, like in a pulmonary embolism case, I will avoid extensive bag marks ventilation, so I don't want very high positive pressure ventilation. Such pointers should be there. So based on the case related pointers and some common pointers for everybody.
In fact, instead of nasal cannula, you can always say that you can start a HFNO.
HFNO, yes.
ventilation, because one is high flows, and second, it gives a PEEP of at least 4 to 5. So that is, they do in anesthesia with something called as Thrive. So here in ICU, we do it as with the HFNO. Okay. They will basically test you to see how safe you are. That's all. They are not going to test your depth of knowledge. That I have seen. They will see how safe you are to the patient. That's all.
And the pointers are also based on that. They ask common scenarios. Another thing you need to remember when you are attempting a CCS, अगर एक question answer नहीं किया है, it doesn't mean आगे का answer नहीं किया है. So if the first minute has a diagnosis of HELP syndrome and you have not mentioned HELP in the DD, forget about it. You know HELP, and the further minute is based on that. I will answer all the questions related to that minute. So every ball is a new game. ये मत सोचो मैंने फर्स्ट ओवर में परफॉर्म नहीं किया तो मैं सेकंड ओवर में नहीं परफॉर्म करूंगा एंड आई लूज द मैच. इट इज नॉट सो. हर बॉल को एक नया गेम समझ के खेलो एंड जस्ट हिट अ सिक्सर ऑन दैट बॉल.
Exactly.
हम
See, you've been studying so hard for the last 5-6 months. It is impossible that you don't know. You know everything. Probably that you can't know everything. That is also there. So you there may be a fair chance that the next questions which will be asked will be the things which you know. So one thing is, be very, very frank. If you don't know, just don't beat around the bush. You say you don't know and go ahead. Okay, you should come
So
till
take hints
the
from
end
them.
of the life. You should come till the last scenario in CCS. Okay.
Correct.
And in CBS, if the examiner is hurrying to change to the next slide because you are fumbling, please allow him to do that. Okay, because it is for your benefit they are doing that. It will be very unfortunate that if you can't complete those 10 or 8 questions of CBS, because definitely it would have been some questions which you definitely knew. Okay, if there are means each examiner is different, but if they are hurrying up, they know that they are trying. You feel that they are trying to help you, because you can always come back in CBS. Yes, madam.
In CCS, do attempt the question. If you have slightest idea, attempt it. Give yourself 10 seconds. Like the question was, how do you wean an ECMO? नहीं पता मुझे कैसे करना है. I have not used it, but I know while weaning, I will check the parameters. I will look at hemodynamic stability. My weaning prerequisite is that the primary condition has to be corrected. इतना तो बोल सकते हो. You give 2 points there. So common way may answer it. You may not know proper numbers, but he will give you marks for those common sense. So don't give up. CCS may not be able to come back. So whatever you want to answer, you answer. But if you are not able to answer one question, don't take it that कि मुझे आगे के नहीं आएंगे और मैं fail हो गया हूँ. Just reach the last question. Give your best attempt at every question. 6 नहीं तो 4 ही सही. 4 नहीं तो 1 मार्क, but attempt करना है. ठीक है, क्योंकि क्या स्कोरिंग हो रहा है हमको नहीं पता. He may actually be scoring you for all the common sense answers that you're giving. So कुछ भी नया चालू मत करना. अगर if you think you don't know ECMO weaning, forget it. वो एक ही क्वेश्चन नहीं आएगा ना, बाकी के सारे बोल दूंगा. Okay, don't start anything new. Revise what you know and attempt what you know. So CCS, attempt something or the other and go ahead. You will not be able to come back. After going ahead in the next minute, they will tell you what you have missed in the previous minute, because they have formatted the minute first questions in such a way that you reach to the second minute diagnosis. तो second minute में आपको वो सारी चीजें पता चल जाएंगे जो आपने first minute में नहीं बोली है. No big deal. It has given you more pieces to fix in and to go ahead. Answer those questions with a fresh start. ये मत सोचो अरे मैंने वहां पे हिट नहीं बोला, अरे मैंने वहां पे हिपैरिन नहीं दिया जबकि इसने दिया है. बिग डील यार. मैं अभी दे दिया ना, अभी क्या करना है देखते हैं. ओके, दैट इज हाउ यू आर सपोज टू अटेम्प्ट इट. ओके, नेक्स्ट इन अ सीरियस, ऑफ कोर्स एज डॉक्टर गुरु सेड, इफ यू डोंट नो समथिंग जस्ट स्किप. अगर बिल्कुल ही आइडिया नहीं है, जस्ट स्किप. इफ यू नो इट, आंसर इट वेल एंड वेयर, पर उतना आंसर कर लो कि वापस नहीं आना पड़े. If you are not sure whether you know it or not and you want to take time, maximum 10 to 15 seconds. That means take a deep breath. 2 deep breath में अगर तुम्हें आंसर आता है तो ठीक है, नहीं तो just move ahead.
Enough. This should be our approach.
Okay? Fair enough? Okay? Answer as if you are the boss and the person ahead of you is the dumbest man. Slow, steady answering, that the message is reaching his brain and he's registering what you have said. Okay. Another question they will often ask you is, what is the role of something? Like, what is the role of steroid in CAP? What is the role of plasmapheresis in this TP? So whenever they ask you the role, you have, if you know any study, just mention that study. If there's that is a life-changing study or something. I mean, the trend-changing study. Mention about it. What is the pro related to that test that you do, or whether that intervention that you do? What is the pro related to, what is the one related to that? And in the scenario, what you will do. So even if you don't know any study, अगर मुझे steroid की कोई study नहीं पता है, I know that we use steroids in certain situations when the patient's inflammatory process is very high. I will say that. What is the harm of using steroids? If the bad bacterial infection, the cure may reduce. That is the harm. But if there is coexisting ARDS, yes, I will use it. इतना सा बोलने में क्या है? Will you use in this patient or not? Last, yes, I will use it in this patient. Or no, I would want to wait till I get the bacteria. खत्म. मुझे कुछ नहीं पता, लेकिन मैंने कॉमन सेंस में आंसर कर दिया. दिस इज व्हाट आई डू एट द बेड साइड. बस वो बेड साइड जो हम प्रैक्टिस कर रहे हैं उसको बेटर कंस्ट्रक्टिंग वे में आंसर देना है. दैट्स इट. उसको अच्छे से कवर करके गिफ्ट रैप करके देना है. एंड यू विल डेफिनेटली क्लियर, क्योंकि जिसने एडिक 1 क्लियर किया है उसको ही अपना सब्जेक्ट बहुत अच्छे से आता है. एंड आफ्टर दैट यू हैव बीन प्रैक्टिसिंग फॉर 6 months एंड रीडिंग फॉर 6 months. So you know your subject well. पहले तो वो thought process लाओ that I know everything and they are not greater than us. Trust me, they do the same things that we do. सिर्फ उनका बोलने का तरीका गिफ्ट रैप वे में है. सेकंड गिफ्ट रैप करके बोलता है, मैं और गुरु गिफ्ट रैप करके नहीं बोलते. So Sekat is not here, so I can say that.
Yeah.
ठीक है? Okay. So you see the way how Sekat answers. It is always in a better, complicated, sophisticated way. And that is what you have to change. बस थोड़े sophisticated way में दे दो उनको answers. That's it.
No, see the difference.
Okay, CBS.
The problem or difference is we practice in India and they practice in Europe. Okay. and they are very protocolized. They are very protocolized. We don't do that in our ICUs. So the psychiatrist, if you would have been practicing in India, he would have not answered like this. Because he is there, he says that. It's just a question of practice. But see, most of us have cleared. That means that it is possible. It's not a magic bullet or something like that. Okay.
Many have cleared. It is not just two of us. Many
Yeah.
have cleared. Okay. And all of you all are going to clear. पहले तो come back to that positive mindset कि I'm going to
Exactly.
ठीक है, ये डाउट में तो जाओ ही मत कि इट इज अ टफ एग्जाम. इट इज अ वेरी सिंपल एग्जाम. मॉक लाइव मॉक्स जो हमने लिए हैं, दे ऑल आर रिकॉल ऑफ द लास्ट 3 एग्जाम्स, एंड द लास्ट 3 एग्जाम्स के रिकॉल में, आई एम सॉरी फॉर द स्माइल्स, जस्ट वन. तो लास्ट 3 एग्जाम्स के रिकॉल में ऑल ऑफ यू ऑल हैव डन वेल. Still, as I said, as Dr. Guru is saying, I use the word sophistication, he uses the word protocol. So protocolized way में answer करो and proper English में answer करो. That's it. That's all. It is just a practice on how to answer, nothing else.
And I am sure that you people would have practiced pattern recognition and all nowadays. So usually in CBS, actually my daughter actually advised me, you first see the last line. Okay, first see the last line. Means the questions they ask, then that will be very fast. What are the abnormalities and what is your diagnosis? Then you go to the vignette. That time what happens is you'll try to catch important points. Okay, so then it becomes easy to answer, because after you read for almost 30 seconds the whole question, the question that they have asked should not be a surprise for you. So very fast you see what are the questions they are asking, and it will save time also. If they are asking only the abnormalities and they have given the abnormalities, why you have to read that much of the question also? The first question में आपको सोडियम कम है दिखता है, पोटेशियम ज्यादा है दिखता है, chloride is more, pH is less, everything that will be seen, isn't it? Am I right, madam?
Yes, absolutely. So CBS में the history will give you the diagnosis. आपका differential वहीं बनेगा. History को ध्यान से पढ़ो. Don't skip the history. Don't try to jump to the investigations directly. अगर CT scan दिख रहा है तो directly CT scan मत देखो. As he said, first see what they are asking, then read the whole question history, and then see what is shown. और उसके बाद उसको answer करो. Sekat has also joined. Thank you, Sekat. So you have to be very, what do you say, in CBS. And अगर history में नहीं समझ रहा है, देखो, we happen to see the investigations. Human mind है, we will see the whole screen. अगर history सोच के एक बार में investigation के नहीं समझ रहा, just skip it. Go ahead. Because I have already lost 15-20 seconds in reading it. और उसके ऊपर और seconds waste करने का logic ही नहीं है.
Because
Right? You have average 1.5 minutes per question.
Because in that 10 or 8 cases, they have got some pattern which they have to do it. There will be 1 or 2 very tough things, and the 2 or 3 medium, and another 2 very easy. Okay, so it depends on your luck which question you are getting first. If at all you get a first 1 or 2 questions which are tough, please don't get feel bad, because there is a balance always in the later half of the CBS. Okay.
And you guys will be able to answer everything.
Yeah.
सिर्फ अपने brain को शांत रखना.
The difficulty levels
Keep
of the
yourself
questions
calm.
are graded.
Okay, they are not, 1 question or 2 questions will be difficult. बाकी सब आप answer कर दोगे. Even in those 2 or 3 difficult questions, you will be able to answer it partially. But take every question as a new question, whether it is CGS or CBS, and attempt it in the best possible way. Okay, give your best shot at every question that you answer. Sekat, do you have anything to say?
I am outside. You can't hear. There is a background music.
Okay, but do you have
We
any
can hear you, Saikat, not the music. You are louder than
You
the
can
music.
put in the chat. They can put in the chat.
Any points we can
Saturday,
give you
I think he's doing a Saturday night.
give them.
Ankur, I want you to smile, man. Madam, he is such a good and excellent person, very knowledgeable. But yeah, I think
So,
somewhere inside he's scared. Somewhere inside he's scared. I know Ankur from my fellowship days, and he was my teacher actually. It is a straight walk for him, I am sure, but somehow he's getting tensed. That's all. Need not, Ankur, you know most of the things. You teach the whole world
he is
with
worried
your
about
videos
मुझे
and
नहीं
all.
आता.
Thank
He
you.
is worried about मुझे एक्ट नहीं आता है, वो नहीं आता जो वो कर रहे हैं. अरे big deal यार.
Yeah,
Be
because I have not
better.
seen because I have
I
not seen Ankur like this. Ankur is always a smiling guy. Hmm. Hmm.
Thank you.
Don't. Okay. Anything else, madam, or anybody wants to know? No, to tell you just that, see, if I have cleared exams, everybody will clear. As simple as that. Only thing different
I
I
say
did
that about
was,
myself.
yeah, okay. Only thing different about me was there was a very nice group formed during our exams, and we did lot of group studies. And as and by how time has passed, more and more material is easily available. And you know what exactly to the when somebody asks me what to read now, it comes very easily for me to tell you. But for us, we had to do lot of homework and research to know what exactly um, we had to read.
So even Sekar cleared it for 2 weeks. So anyone can clear, he says.
That a long
So
time.
actually, you all know your content well.
Yeah, he is trying to be very diplomatic.
No, actually, this is true. Huh? Sekar had hardly read, and he was like
No,
suddenly two.
see,
I
because
mean, there was something
he doesn't need any reading, madam, because the way they work is that. For us, ऐसा नहीं होता है.
It's true. It's true.
It doesn't happen to us.
But if you check Guru, you can always read. You need to know subject. In our times, we know material. I'm saying Guru ke time, at least there were mock tests that.
Yeah. Definitely not demotivation, Ankur.
I think I'm missing on the fine points. That's the issue I felt in the mocks. I'm not able to conclude. Means start ठीक हो रहा है, but it is getting not a fine finish.
Only thing when there are some controversial areas which you have to answer, if you are not sure, don't make a blunder. That's all. Because once you speak, it is committed. Okay. Don't make a blunder if it is some very this one. Abhi, for example, I'll give a scenario of SAH, okay, which is a bleed, and same time MI का scenario आता है. Okay, never miss. Why I'm giving this example is, don't say you will thrombolize or do something, because उधर ऊपर bleed हो रहा है, and the patient presents with some Takasubo or that type of picture, they'll try to do that to confuse you. You keep aside the myocardial symptoms. They will give you an ECG showing ST elevation and all. Now what you will do? You should know that it's a link, and because you know already there is a bleed in one place, you should not tell that you will thrombolize. So, I think most of them will agree on that.
Sekar is asking, I gave what? What is he writing? I gave my third mock to Dr. Guru without any preparation, and that too before the exam. So, Guru, how had he performed then? Do you remember?
Yeah. He gave me a compliment also that I was very kados, it seems.
So Saikat, actually, I don't know if he had read or not, but he contacted me like 10-12 days before the final exam that I want to give your mock. And I was like, Arey, abhi kya dene gaye teko? So he's like, no, I want to give mock 3.
Who?
Saikat,
Second,
had
second.
हाँ मतलब उसने पढ़ा क्या था पता नहीं, but Critilearn में he had registered only for the 3rd mock.
Okay.
Maybe like 10 days prior, 10-12 days prior to the exam, he's like, मेरे को mock देना है. And then I told Guru. Guru this time was less active, वरना Guru takes many mocks.
No, the recorded lectures has helped. The
हाँ,
CP.
amazing lectures he's made. Now he's making a complete echo course. He's working for that. That is why he's given this free, leave to not be a part of this EDIC. It is so again, Saikat is saying it is more on how you speak rather than your knowledge. So
Correct.
first of all, as I said ना, तुम लोगों के पास knowledge है. पहले तो वो mindset में आओ. You know it. You know your subject very well. गोरे वालों को कुछ नहीं आता. They feel, उनको feel होना चाहिए कि तुमको आता है. That's it. Okay. मतलब मेरा तो first upset is about giving EDIC. I never wanted to give EDIC. मैंने किसी के force पे दिया ये exam. But वो literally मुझे ऐसे लगता था मैं गोरों को खुद को assess करने के लिए पैसे दे रही हूँ. ठीक है. Whereas I know what I am. I know myself. I give an exam every day in the ICU and I fare well. So Gore don't need to tell me that I am good. Okay, and Indians are much better than those Gore. Okay, so we are giving our exam just for some degree. Okay, क्या value है वो सब हम बाद में बात करेंगे. But you all know your subject. The way you answer is going to make a difference. Answer as if that person is dumb and give him every possible thing related to that answer. Okay, and think like a senior person. Don't think like a junior. ठीक है. एक सीनियर जैसे
Good
आंसर
morning,
दो.
madam.
हाँ.
Pralay.
Madam Pralay, can I ask one question?
Please.
Yes, brother, yes.
Yeah. Actually, I was asking that if I get one question and I don't know the answer, should I just tell that I don't know, or I should means in like case-based scenarios, or I should guess and try to give some answers. So, what do you suggest?
You are talking about CCS or CBS, Pralay?
The case-based CCS.
Yes, yes. Okay, no, best thing is to say that means if you have got absolutely no idea, then go ahead.
Okay.
Because the case will get linked to something which you know. From
Okay.
CNS, it shifts to abdominal compartment syndrome. Probably you know more about
Mhm.
abdominal compartment syndrome, isn't it?
Yeah.
So there you will start getting points.
Okay.
If you don't have any absolute clue, just go ahead. Don't
Okay.
just
Instead of using this word na that I don't know, just say I want to skip this.
Yeah.
yeah. Next.
Okay. Right. Right.
So I will say when I got we had 3 long cases. We had no short cases during my time. It was CCS 1, 2, 3. They were all long cases. Okay. And my one case was drowning. And case भी ऐसा था, there was a 16-year-old boy, which itself scared me. कि 16-year-old मतलब कुछ तो pediatric हो गया. 16-year-old boy who had been found 5 days later. He was lost 5 days prior and he's lost 5 days later. Okay. He's been found under a cliff where there is snow above and he's there under the water. So when they pulled him out, he was almost like 24-25 degrees core temperature. Okay. And मतलब मेरी तो वहां पे ही लग गई कि यार अभी क्या करना है. And he was done CPR for 1 hour. And the first question was, will you give up on the CPR or will you continue? मतलब first scenario में मुझे ऐसा लगा कि what will be the next thing. मतलब I couldn't make out from that first minute कि वो मुझे पूछने क्या वाला है. Okay, and the whole I could answer literally 80% of the questions क्योंकि आगे questions यही थे. Will you give up on the CPR? No, because he's hypothermic. I want the temperature to come high before I give up on the CPR. पहला question ये था. फिर उसके बाद उसने मुझे ऑसबॉर्न का ECG दिखा दिया. ऑसबॉर्न का ECG सबको आता है.
Okay.
Then he asked me, okay, finally he got the patient revived. He took him to the ICU. He showed me EEG and SSEP waveforms. वो टाइम पे EEG और SSEP कहीं पे भी उसका डेटा ही नहीं था to learn. And I had not read about it. And I told him I don't know. So he told me you look into it and you still see if you know it or not. Then I again looked into it and I said I don't know. So then he said, no, you look into it and tell me what you know about a hypoxic brain injury which will come in that EEG.
Okay.
So I just looked into his face and I gave him the answer because I don't know what is in the EEG, but this is what you see. You see an
Yes.
isoelectric ECG, you see a burst suppression. I told him that, and one of the answers was there. He ticked for one of them. I don't know what he found. SSEP, what he asked me SSEP में what you see. तो same way, same trick उसका use करके I told him SSEP में क्या आता है hypoxic brain injury में. वही मैंने बताया, he ticked it, N20 absent. He ticked it,
Yeah.
and I got the answer right. So don't think you don't know something.
Okay,
Okay.
madam. Thank you.
So you know everything, even if you don't know, आपको theoretical aspect पता है ना, give something about it. In कोई negative marking तो है नहीं. तो some part of answer you can definitely give.
Okay. Thank
Madam,
you.
Okay.
Ankur has put some, Ankur has put some message. Is it for CCS or CBS, Ankur?
It is for CBS. Actually, I had a query that suppose if I have skipped a question, that's fine. But
Oh.
suppose in the loop I have made a mistake, it clicked to me that I need to change that answer. So you can't change it. So if you are not able to answer a particular CBS slide, skip it and then come back. Half answer you cannot come back. That's the reply they have given.
Okay. That may be
But
possible.
in CCS you can't go back.
No,
In
for
CCS,
CBS.
you have to answer and go ahead.
No,
So
no,
do give
what,
some.
no, what Ankur is telling, CBS, he answers, okay, but he doesn't completely answer. Only after the next 2-3 slides, he realized that what he answered for that CBS is also wrong. Now he wants to come back to that CBS to rectify the answered question, wrongly answered question. That they have written, that can't be done, it seems.
I specifically asked, so they told that it can't be done. Only those CBS you have
Depends
skipped,
on the examiner.
you can answer.
It all depends on the examiner. I would say that way. There are some examiners follow them. Okay, because I have changed the answer in one of, because I was never so good. I'm still not so good. So I'd said something, and the examiner only told me you want to skip it. Because I was going in the wrong direction, so I skipped it. But I gave him the wrong answer. He didn't mark me there. He asked me to skip it. I came back to it. He allowed me to answer it all over again.
तो थोड़ा
And he
मैडम
marked me there.
ऑरा का भी फर्क पड़ता है, कौन एग्जाम दे रहा है.
तेरा औरा अच्छा करके जा, स्माइल करके.
Ankur,
तो
see,
वही तो फील कराना है.
Ankur, in the answer, what they have replied, as the time is limited, it is not possible to go back and change the answers already provided. Probably, okay, if you finish your CBS early, you have got 1 or 2 minutes, they will go to the question.
Okay.
If the time is short and is gone, then no issues. If you got time, probably a good examiner. Again, there will be different type of people. Some will be very strict, some will be very relaxed. It all again depends on our luck. Okay. I told now for my CCS, they gave me at least 5 minutes to speak out the word community acquired pneumonia. वो भी नहीं आया मेरा मुंह से. From where is the pneumonia come? From where is the pneumonia come? I didn't tell community acquired. They wanted those 2 words. Okay.
पर सीसीएस में आप वापस नहीं आ पाओगे, ये याद रखना. अगर वो आपको वहीं पे हेल्प करता है तो अलग बात है, लेकिन अगर आपको नहीं कर रहा है वो हेल्प, तो आप वापस नहीं आ पाओगे. तो सीसीएस में जो भी बोलना है, वॉट एवर यू वांट टू स्पीक इट देयर, बट स्पीक सेंसिबल. ऑफकोर्स अब आप थ्रोम्बोसाइटोपिनिया को थ्रोम्बोसाइटोसिस नहीं बोल सकते, उतना ग्रॉस नहीं बोलना है. बाकी दे आर नॉट देयर टू फेल यू ऑल, दे आर देयर टू पास यू ऑल. दे आर गोइंग टू मार्क यू गुड फॉर और अ टिक इवन इफ यू गिव हाफ द आंसर. And pointers is the best way. हम लोग मतलब in my time we तो had must know, definitely know and desirable to know. Okay, must know, need to know and desirable to know. ऐसा होता था. तो we had 5 marks for some pointer, 3 marks for some pointers and 1 mark for some pointer. So if I answer all the 3 and 1 mark, I still failed because I did not answer the 5 pointers. So we need to answer all the, जैसे अगर SAH के complications पूछे जाते हैं, if I don't answer rebleeding and vasospasm and I answer all else, I will still fail. Because they wanted directly to know answers for sure. It has become easier now by saying, it is same marks for everything. So any you answered is okay.
Why is that other people don't have any doubts?
इसमें
Tom,
एक मेरा क्वेश्चन है. I think in the mock we were told that if we skip a particular line or term, like I don't say RRT, so they won't show me the CRRT questionnaire. So it is the same right now, or they will show the vignette actually, even if we don't utter.
So this is in May 2023 exam, they did this. So when May 2023 exam recall was taken from various students, some students did not give us some questions at all. So when we, like, I literally had to call them and I asked them, Ki, did you get this question? So they were like, no. So then I asked them the previous question. This is how I went back to the one who gave me that question. So he said, Ki, I answered this. So they asked me this. So when I went back, then Sekat, when I spoke to Sekat, so Sekat told me, yes, this is a pattern here, that if you don't answer certain question, like related to it, like if you don't say RRD, so then the next question will get skipped. But in November 2023, there was no such thing. Everybody got all the questions. So even if you said, they said no for heparin, for this TTP case or a case, they still went ahead to ask what are the pros and cons of heparin. So if they said no for intubation in the PE case, they went ahead to ask the pro and cons of intubation.
Okay.
Okay. So this November they didn't do that, but in May 2023 they did that. So from May 2023, the mock 2 and mock 3 specifically, you must have seen this kind of arrangement in our live mocks, because we have done a proper recall of them.
Tom, you don't
Yes,
have any
sir.
thoughts, Tom?
Nothing,
Tom
sir.
is
Just listening to.
confident.
Hmm.
Nay,
Deepti,
Tom,
And
you'll be able to do it.
and
Tom, Ankur, Pralay, Anjali, every Dipti, you also will be able to do it. Salahuddin, I've not taken your mock, but your feedback is good. And Bhavya and Arun, I'm sure you all are well read. So you all will be able to do it. Sirf yahan pe, this one, Ahmed hasn't joined. The rest have all joined who are giving the exam. I'll share the video with him. So
Pralay,
stay
ma'am,
calm, right?
ma'am, any
Yeah, Pralay.
cases for transplant? Like, should we read anything for transplant or?
it is
Transplant,
not in
honestly,
depth.
not in depth. मैं एक ना notes
Probably
share
a
करती हूँ
post
on the
transplant may
group.
come to the ICU and land in complications. Okay.
एक one request is there, अगर डॉक्टर गुरु या साकत एटिपिकल ईसीजी के खाली इन्यूमरेशन अगर ग्रुप पे डाल दें, ये एटिपिकल ईसीजीज जो लास्ट मोमेंट पे जस्ट एक गो थ्रू है, हालांकि लिख रखा है मैंने, बट इफ एनीवन कैन रिमेंबर कि दिस एटिपिकल ईसीजीज गो थ्रू लाइक एलवीओटी था, आरवीओटी था, लाइक दैट, तो इट वुड बी इजी. वो एक बिग पॉइंट है.
And that's what the broad complex tachycardia, unless proved otherwise, it's VT only. Okay.
नहीं सर, हमने एलवीओटी टैकिकार्डिया डाला था.
Because even today,
गुरु
when
ने
I say
दिया था
VT, they say it is
गुरु ने check.
SVT with aberrancy, and I say it is SVT with aberrancy, they say it is VT. Only thing lucky is I have cleared the exam, that's all. So when I ask most of them, including the cardiologist or whatever they say, broad complex tachycardia, unless proved otherwise, it is VT. Okay.
देख अंकुर, out of 10 ना 8 questions simple होंगे. So don't try to run behind those 2 questions. तू जितना रिवाइज कर सकता है कर ले, वरना तू बेसिक चीजों में गड़बड़ मत करना बस.
Yeah, aberrancy with irregular heart rate. Okay. Be very careful answer. AF with aberrancy, na? Be very careful when you answer that, because you should not use any AV nodal drugs. That will see, these are the things they look at. This safest thing is you say cardioversion first. Okay, you can, I think you can tell that I'm confused about this, but the safest will be cardioversion instead of drugs.
Okay.
Isn't it, Gunjan madam?
Yes, yes, I agree.
Instead of telling a AV nodal blocking drug as a treatment of choice, because I am confused about this, whether it's an AF with aberrancy or some other thing, I would prefer a cardioversion. It is a safe way of practice.
Again, coming to that point, we want to be safe.
Yes, exactly. And that will be the answer actually. Cardioversion will definitely be one of the answers. Because even if the patient is hemodynamically unstable and you are unable to decide, see, if you give some AV nodal drug, the patient will deteriorate. But if you give a little bit of sedation and then shock the patient is going to improve. Isn't it?
बराबर. So from my side, good luck to each and everyone who is giving the exam, and thank you to all the faculty.
I'm sure that all will do well. You have put your hard work. It will not just go waste. See, for me and all, degree was never important. But the amount of things I learned in that last 3 years was really very amazing. On which I could build so many things.
Absolutely. Even EDIC ka main use is that even if you're not going abroad, you really know your subject in and out at the end of it.
Mine is an evening slot on 7th and afternoon slot on 8th.
Same.
Yeah, yeah. Okay. More important than knowledge and subject. Please, your internet. Okay. And keep one spare internet connection also, if possible. You have got another 2-3 days time. Okay. At least take a 1 month subscription of another alternative internet and keep.
My suggestion is still 2-3 days are left. If anybody wants, on Amazon there is a Geo Fiber UPS sort of things. It's very small, somewhere around 1000 or 100 and 1500. It gives you 4 or 5 hours of backup, even if the light goes.
UPS, na?
Small UPS.
Yeah.
Small difference.
Okay, these are more important because we start getting calls telling that we are unable to log in and I can't hear, they can hear. Okay, yeah. Last time what happened, everything, the connection was okay, everything was okay, but what the candidate used to talk, they could hear. But what they were talking, the candidate couldn't hear. You know what was they did everything what was possible. They checked. Unfortunately, the system was muted. Okay. The system, they had put a mute button on. Okay. These things, see that it doesn't happen. If you want, I can help you to this. On Zoom, we can log in, you can check your speakers and all those things.
Now, day before yesterday, they had a check run. Their connection was slow. Our was Geo Fiber must running.
Yeah. No, but they are very considerate. Once Anand, one of the person who is in Critical, Anand, his exam was scheduled at 6 o'clock. I think it was happening somewhere in Belgium. There was some technical problem. The same exam he gave at 12 o'clock midnight after 6 hours.
Oh my God.
How he gave after 6 hours?
Yes, it was their problem, not his problem.
Okay, if there is a problem from
He
their
gave
side.
during COVID time, no? He gave during COVID time, no?
Yeah. Post-COVID, madam. Post-COVID.
Immediate post-COVID time he gave.
If there is a problem from their side, they reschedule.
Yes.
I don't want this thing.
Okay. No, that's what
Relax,
you will read and do all those things, but see that your battery backup of your MacBook or laptop is very, very good. If you are using a CPU, you have got a good power backup and good internet connection. Keep one spare internet connection. Okay. These are more important than, because what happens is if your start gets fumbled because of these issues, you become very tensed. The exam doesn't go well. Okay.
EDIC one, they didn't accepted Aadhaar. So I need to show them my driving.
There's a lot of confusion about that. You keep both ready.
So I need to show
Whichever they
them
want
my
to
driving
accept.
license.
Or passport or whatever.
Okay.
Bhavya and Arun, do you all have any questions? You all were not a part of live mocks.
I think framing of the answer is very important, ma'am. Maybe don't know how we do before the examiner. Even we know the answers, we were unable, I feel that I am unable to speak out to them in a proper manner.
We are also facing the same.
Sir.
So, Bhavya, the trick here is just to think that you are the boss and you're telling a dumb RMO how the answer.
नहीं, रोबोट ज्यादा अच्छा है, वो करेगा ही नहीं.
रोबोट भी चलेगा, वो आरएमओ भी नहीं करेगा, वो उल्टा कर देगा अगर सही नहीं बताओगे तो. ठीक है.
No, but mocks has helped actually to realize that we are weak at certain points. We are weak in framing the answers. That itself is a boost. And at times, it also gives confidence that some questions and some patterns in CCS are common. वो तो कर रही हैं. So that gives an idea. I think my schedule will be today we'll review the CCS part and next 2 days only focus on the CBS, which
No,
Saket told.
Ankur, be prepared that out of those clinical case scenarios, I don't know whether they are doing 4 or 5, one will be offbeat.
Hmm.
One will be offbeat. And don't break your head for that offbeat case.
Yeah.
Look at a bigger picture and you know the other 4 cases, which we see day in and day out in our ICUs.
वो ऑफबीट सीसीएस में भी ना only 1 minute is offbeat. बाकी
Exactly.
सब जगह पे होता है.
Yeah.
You will be don't give up कि first minute नहीं आया मेरे को आगे का नहीं आएगा, ये सोचना भी मत. You may know the next question and वो next question में सब आंसर देना है.
I
ठीक है?
still remember in one of the mocks, I missed totally. Actually, it was Edison's and I was moving towards sepsis. Okay. I missed to catch the clue that the patient is not responding either to fluids and vasopressors.
Hmm.
And there was hyponatremia and hyperkalemia. See, these are small things actually. That combination of hyponatremia and hyperkalemia with the patient not responding to fluids and this one vasopressors. That was Edison's.
वो मेरे एग्जाम में पूछा गया था.
Or and some of the one incidents will initiate the Addison's, either a tooth extraction or a sepsis. Some stressful condition will initiate the whole event. That's what, no, simple things.
That CCS is still there in the mocks.
वो बोलता फर्स्ट स्क्रिटिलन पे फर्स्ट मैंने वो जो लिया था वो एडिसन ही था, उसको देख
हाँ.
के कोई एडिसन हो गया, मैंने कहा कुछ नहीं आ रहा है.
वो मेरा मॉक था, वो मेरा फाइनल था. एडिसन्स और ड्राउनिंग और तीसरा एमआई को हिट हो गया था.
So, yeah.
वो मेरा फाइनल एग्जाम
So
था.
common things are, one is toxicology may definitely there will be one. Environmental may there will be one. Or there will be toxicology which goes into environmental. Okay, he takes antifreeze and sleeps outside where he becomes hypothermic. That will be the chain of events. Okay, because there the winter is bad and all, or drowning. So that will be the link usually. And hypothermia may don't give up resuscitation. That is the answer. Because they have resuscitated somebody for 6 hours and still the patient has survived. वैसा कुछ story है. So
वो तो
no,
मेरा फाइनल एग्जाम था. Will you
yeah,
give up?
no give, yeah, don't give up resuscitation in drowning, hypothermia, drowning and all. You just continue. And you can speak about ECPR also nowadays.
नहीं, टेम्परेचर 35 के ऊपर तक आते तक करना है ना.
हाँ, अगर
Yeah.
35 अच्छा हो गया तो you can stop.
That's what till 30 degrees, you can give only this much of adrenaline. After that, those protocols are there. Because I'm off touch, I'm unable to tell things.
Yes, yesterday night, means day before yesterday, I gave mock 3 and I missed out on both the loops for respiratory. So I revisited Kitilan, that ventilator video, and then 2 videos from ICU Reach. I contacted their owner also for that. So those 2 videos I'll share on the group. They are very good in picking up these cycling issues. उसमें तो आज जब ये CBS चल रहा था, I would able to make out कि what mistake I have done. So anybody have any problem in
Thank
that?
you.
I'll share.
Thank you, thank you.
You share in the
Uh,
group.
Thank you.
Madam, anything about post-operative cardiac surgery patients?
One patient will be there, Arun.
Hmm.
One patient definitely will be there from the post-op cardiac.
So I'm weak in that where to read because I don't usually handle the post-op cardiac surgery patient.
Acha.
Also, but one while solving one CBS, I don't know from where e- esophageal Doppler looks like RT, but ending in between. So esophageal Doppler can be we need to identify esophageal Doppler is there on X-rays. Just have a look on your Google how esophageal Doppler looks like. Means it's
The
simple.
pacemaker ECGs,
Pardon?
any pacemaker ECGs, like very basic.
That will be the CBS. Okay. And what exactly? Yeah, you have to see those. This one.
Failure to capture.
Facing this one marks.
do they give even LVOT, RVOT ECGs also?
Huh?
That's what, madam. See, out of 8 or 10, one some odd will be there. Okay.
But I took the advice of Saket
Yeah.
that मेरे को नहीं आता तो औरों को भी नहीं आता होगा ऐसा टाइप ऐसा
Perfect,
feel-
Ankur, perfect.
See,
ये
because
बहुत
to
सारी बात
that.
है.
because we are not a cardiologist or electrophysiologist. Okay, we
Yes,
are.
yes, sir.
Okay, so basically, what you are expected to know is with that ECG, if the patient is the patient hemodynamically stable or unstable, how you will manage that? Isn't it? Whether it is an RVOT or LVOT, management to again ABC से चालू होएगा. Is it?
Yes, sir.
And that is the thing they look at. That is one best part of the Westerners is they look at the basics. Okay. Yeah, yeah.
While doing ECG, sir, as you told before, even I had a problem with. I used to tell that it was VT. Then the answer was AF with a bundle branch block. I was really confused that I don't know the simple basics of ECG. I was thinking, so it confused me a lot.
See,
I
that's
don't know what answer to give.
yeah, I told na, in ICUs, what you look at is how you revive the patient and how you don't. I gave the example. Na, if there is an irregular heart rate with an broad complex, please don't give any AV nodal drugs. Like that.
Okay.
Yeah. Okay.
चलो
Anything else? Salahuddin, Anjali. You can even put it later on in the group.
Dr. Guru, do we get pediatric cases also, burns and
no,
all?
No, madam.
We
No,
will not get.
pediatric is out of question.
no, pediatric nahi denge.
Can you share some atypical cases or atypical CVS? Can you?
Yeah, I'll just check, madam. I'll just check, madam, and let you know. I am sure that all of you have done crit IQ.
Most of it.
Yeah. No, though I am telling you very late because in our initial introduction classes, I have
No, no,
always
you have said before also. Guru.
yeah,
Ekam has also told.
yeah.
ECG
Crit IQ is one. Atypical, to the same one, Bhavya, whatever you told, na, the confusing ECG, they will be confusing lifelong, even after your exams. By
So,
that time,
Bhavya,
by that time you would have passed and gone, but still it will be confusing.
Not only
very
ECG, sir, any cases also atypical apart from what we do regularly in our ICUs.
Yeah,
Which are
that's what you should think. You should think from the Westerners' points of view. I told na toxicology. See, there are a lot of hypertensives and diabetic. So, and see, we people are very hale and healthy people. They are all psychiatric people. So they keep on taking all the drugs and all. Okay. So obviously the doctors there will face these cases only. overdose, and all those things. Okay.
Okay.
They are the only offbeat things. One is weather conditions are extremes there. Okay. And because they are advanced and they are jobless, they do all these things. Government supports them for everything. Na? They not have to worry about the cost also. So they end up doing all these things. They
They
take enough of beta blockers. Okay. And one more thing. For any end organ damage, please end up yourself with a VV or a VA ECMO or a CPB. Okay.
Or
CPB, cardiopulmonary bypass.
okay.
Whether it is a beta blocker or it's an liver paracetamol. Okay. So the case usually will end with either VA ECMO, VV ECMO or transplant.
Okay. In environmental, what are the topics they can expect?
That's what hypothermia, hyperthermia. Because last, I think, not last year, before that, there was a heat wave in the east, in the west. So they had put a case on hyperthermia.
Drowning.
So heat stroke.
Hypothermia, drowning.
Yeah.
Avalanche, वो तो ही हो जाएगा ना.
Yeah. And alcohol, ethanol alcohol, ethylene alcohol, ethylene glycol.
Carbon monoxide है ना.
IV drugs, then endocarditis, then rhabdomyolysis, then tumor lysis syndrome.
वो तो
refeeding.
Just for the revision's sake or by clearing confusion, there are 3-4 gaps. One is lactate gap, osmolar gap, then
CO2 gap.
CO2 gap.
Yeah.
CO2 gap is because of the shunt.
Pardon?
CO2 gap is because of the shunt. Ventilator.
No.
Shock में होता है ना CO2 gap. More than 6. Normal CO2 gap is 6. If the patient is getting मतलब lactate नहीं दिया है and patient is in shock, perfusion is hampered, the CO2 gap will be more than 6.
Shock में.
Yeah. And even in dead space ventilation also it changes. Okay.
That lactate gap, osmolar gap. Lactate gap is ethynyl or
ethylene glycol.
Osmolar gap
because of the lab error.
Lab error, हाँ. तो osmolar
CO2 gap is sorry, go ahead. Sorry, what are you asking?
Lactate gap is because of ethylene glycol poisoning because of lab error of glycol picked as lactate. Osmolar gap means poisoning, ethylene glycol, ethanol or your methanol. Then there is a CO2 gap. CO2 gap is because of the dead space of VQ mismatch in EtCO2 and the arterial CO2.
No, CO2 gap जो आप बोल रहे हो, if it is between arterial and venous, it is mainly because of hypoperfusion.
Hypoperfusion. And then there is a SpO2 and PaO2 which in methemoglobinemia.
Yeah.
Yes.
These are the 4 gaps.
Methemoglobinemia.
For all, if the serum osmolality is given, please calculate the osmolality. Okay. If the serum osmolality is given 100%, you should calculate the osmolality. Okay. And you see the units. Okay. Only if they have given in milligrams per percent, then you have to convert it. Okay. Glucose divided by 18 and urea divided by 2.8 plus 2 times sodium.
From past session, they told that they are giving both millimoles and milligrams.
So you take that moles ka, then there is no conversion at all.
Yes.
Then there is no question of conversion.
Okay. In every CBS, they will give you the both values, right, sir?
Yeah, they have given. I have seen the bracket में.
Last 6 months they are giving. पहले नहीं देते थे.
Yeah.
मैडम वो CO2 गैप अपन ने आर्टरियल PO2 और PCO वीनस PO2 में था. एक EtCO2 और PaCO2 में
arterial PCO2 and venous PCO2.
नहीं, one is EtCO2 minus EtCO2 and PaCO2 में भी अंतर है. वो
that is not called a CO2 gap.
उसको मिस
टर्मिनोलॉजी CO2 गैप जब यूज करते हैं, दैट इज डिफॉल्ट आर्टेरियल माइनस वीनस.
शॉक में. ठीक.
Sir, one
बोलो दैट इज शंट एंड डेड स्पेस जो गुरु बता रहा है.
Just one thing, like PCO2 and if they're, if you see, suppose in the monitor they're giving that patient is hemodynamically unstable and ETCO2 is suppose 15 or 20, what should be a differential when and the patient is normally ventilated?
Sorry, sir, we didn't get you.
Suppose in the
Pulmonary
monitor,
embolism.
No,
sorry,
hyperventilating. Could be hyperventilating patient.
no, I'm saying that
Pulmonary
patient is
embolism.
normally ventilating,
Hmm.
suppose 12 to 14 breaths per minute,
Hmm.
and you see they're showing that ETCO2 is around 20, and in the gas the PCO2 is 40 or whatever, 45. What will be your differential?
Massive pulmonary
Pulmonary
embolism.
embolism,
There could be a
low
leak in
cardiac
the
output state.
circuit.
Sorry, one by one.
Leak
Low
in
cardiac
the
output
circuit.
state, pulmonary embolism.
Low cardiac output, pulmonary embolism, massive pulmonary embolism.
Okay. Yeah. So basically, like hypoperfusion state, any cardiogenic shock or embolism. So keep differential in mind so that you can pick. See, it's all about pattern recognition so that you don't waste time on this thinking why patient is PCO2 gap is low. The PCO2 and ETCO2 gap is has increased. Now another scenario, suppose in the vignette, it can be in the CCS or CVS in the context of respiratory failure. Patient respiratory in the respiratory, you see the A gradient is normal, but patient has got respiratory failure. What thing should come up in your mind? A gradient is normal, and the patient is having respiratory failure.
Central cause, no? Go for central cause.
And
Cause
much more common,
myasthenia could be there, GBS could be there.
right? Neuromuscular diseases should come into your mind, or any motor neuron disease. So these are subtle clues, like you can pick up. They can give in the in the CVS or CCS. You have to save your time. So like they will not say a gradient. You have to calculate, like in the initial 10 minutes, try to find out what's the saturation, what's the PO2. Try to calculate a gradient. So easy rule of thumb is that FiO2 into 500 and subtract it from the PO2. If it is more than 30, 40, 50, you can say the A gradient is high. No need to do that that clumsy calculation, like 7 for what is that formula? FiO2 into atmospheric
Ankur,
pressure minus.
Ankur, that easy calculation of ABG video is there, na? In the 15. Yeah. एक है cycle.
Second last
yeah.
video is there. Yes, video is there.
That easy calculation of in ABGs.
Yeah, so but the basic thing is that you have to pick up. So like they can ask what the cause of the respiratory failure. So if the scenario is like A gradient is normal and the patient is having respiratory failure, then you can expect in the vignette coming, they will ask you about GBS or myasthenia, or maybe motor neuron disease, because motor neuron disease is relatively common in the Western world. So you can go through the academic module. They have mentioned about all these things in the academic modules. Neuromuscular diseases.
One very means last minute request. If only the names of at least some important trials can be mentioned, then we can read out the summary of that.
Whatever, then, so if important trial, just pick up a topic. I will try to tell you. Pick up a topic.
Okay.
You can write it now.
We'll start from CNS.
So don't give a huge, CNS is a huge topic. Pick up an important topic.
Put it on the group, we will reply.
Yeah.
ऐसे तो this
So
whole
like,
session for another 2 hours if we start listing the
Zoom
trials.
खत्म नहीं होएगा.
yeah.
Zoom
So basically for CNS, now people are talking about tenecteplase in stroke. There is a AHA article on this, review article published, I think, last year end or this year beginning. Go through that, tenecteplase. If they're asking about stroke, they can ask about tenecteplase. Don't expect they will be asking about alteplase. The role of anticoagulation if patient has AF, like ELAIN trial. These are few landmark trials. So There are many trials in the market. Which trial you need to remember? Those which are published in big three journal, NEGM, Lancet, and JAMA.
Sir,
No need to know
you're
what
telling
ICM has.
we, sir, we know that what the trial is, but we don't know the name. Can we skip the name and tell what the details of the trial are?
Yes, yes,
Sorry,
you
I
can.
didn't get your
They
question.
don't expect to tell you the name. The
They
concept
will
should
not
show
tell.
that.
Okay.
They will ask you about your practice. So your practice should be based on the current evidence. You got my
Okay.
question? Like, let me put this way. Suppose there is a stroke case or a neuro case or stroke case, and you noted patient has got AF and a relatively huge stroke as per the vignette. Now they may ask you, when will you start anticoagulation? So essentially this boils down to the recent evidence. You have to know the evidence. They will not ask, tell me the ELEN trial, tell me this trial, tell me this trial. They will never ask you.
No,
Nobody
we
will
need to
ask you.
specify the name during our answer. Like
No,
because
no,
of this trial, we are telling this.
no.
So
When you'll be answering your thing based on the current evidence, they will automatically know that you know the trial. If you don't know the trial, you're not able to answer. So your answer will be based on what the current evidence saying and what is your best practice. So invariably what happens, so there is another thing here, like a trial is coming now, suppose in 1 month time. Will they ask any question? No. So in the last at least 6 months back, whatever the big trials have come across, you should know whether you should adopt or change your practice based on the trial or not. You need, so first and foremost, they will check, are you a safe intensivist or not? Like a major stroke, and if you say I will start anticoagulation in next 3 days, then and there you will lose point. That does, you may not know about the major trials, but you have to rationalize your answer. Like saying it's a major stroke, I will wait for 2 weeks. And even all the trials have shown in the major stroke, you can wait up to 10 days. So indirectly, you are correlating your practice with the available evidences. Like I was talking about what is that called? Selective decontamination. Do you practice in here? No. So, but in Europe, they practice mainly in Netherlands. How can, if they ask something like, will you use? You can say the trial is based in the developed country. If they ask about the trial, not done in any developing country, I don't practice. They will not mark you negative. They will have both the answer. They know this type of thing not being practiced all over the world. Now, similarly, suppose there is a respiratory failure case, and they will ask you the question, when will you start VV ECMO? A patient is 3 or 4 days, you have trial proning, you have trialed all the conventional measure, and will you consider ECMO? Now, you will think earlier trial has shown no benefit, but that's what the conclusion. But the actual meaning is different. Early ECMO is favorite. So in this way, they will be asking you the evidence. Similarly, if they give you a cardiogenic shock, they will ask you, when will you start this patient on make a ECMO support? There can be a cardio. Suppose a AMI patient, patient is hemodynamically unstable. You have taken to the PCA and all. Patient still patient still recurring lot of inotropes vasopressors. They will ask you what is your next. So you have, what will be your answer? When you will be starting your ECMO? This is based on the recent trial, ECLS ECMO trial, which is published last year. So you have to know the ECLS shock trial. So you have to see that whether all the conventional measures have failed, and then only you'll go for the VECMO. There is no role for early ECMO in these cases. Similarly, if it's not AMI related, what will be a choice in ECMO? Then this boils down to another trial, ECMO CS trial, published last year in the AHA. So these are all major landmark trials. Hopefully, I think this much I have to add, and rest you people can ask in the group. Even I think we have stretched for a long time. This is a never-ending discussion, but you can keep on and asking in the group.
Sir, just one doubt regarding, is there any algorithmic approach of the Stewart approach of ABG analysis?
Yeah, there is easy, but for that there is also video. You can ask in the group, we can answer, but it's not possible to tell the algorithm approach in the Stewart in this video in this session.
Okay.
Ask on
And
the
Guru,
group.
Dr. Guru can help you.
I will, or I can also share a video. There's a good video online. I'll send you that.
Yeah, you can share. There is 3 main steps, and that you can do, and you can read. There are a few articles in the Google. If you even search it in the name of Stewart, those 2-3 articles will come up. However, I will say if you are comfortable with the conventional approach, go by that. No need to change the approach, but it's more important how fast to calculate at this point of time. Joe, the thing you are comfortable. So I think more important, there are many trials. If I keep on telling about a trial, it will take, as Dr. Guru mentioned, it will take 2-3 hours. Like these are important things, like how you adopt in a practice, cardiogenic shock, respiratory failure, stroke, whatever. If you tell about any topic, I can tell what are the topic, trauma related. There are many things, but just one thing, try to answer in a safe way. Like CRRT, if there is a conventional indication, straight away say I will start CRRT. No need to quote any trial. If there is no conventional indication, you will say that we'll just wait. I think we can conclude the session here.
So one more thing, in CBS, will they ask anything regarding drugs?
What specific on drugs?
Not directly. They may ask you, like, they may have what is your drug of choice and what is the precautions you may take for the drug.
Okay. They don't give a drug and ask details regarding that drug. No. Okay.
There will be some interaction, or because of some drug, there will be some biochemical issues. Okay.
Okay.
Like they may give you metformin and then mala will be there. Lactic acidosis, metformin acid, lactic acid. So there, yeah, you have to see what drugs are given and whether it is having some interaction, means any representation in your values because of those. Okay. Direct drugs, they will never ask. They will not ask.
And the last important tip, which I always think before going to any exam since school days, if I don't pass, no one else will pass. अगर मैं लटका सब लटकेगा. But
exactly.
But the problem is you keep on passing, na?
Just, that's a different thing. Pass and fail is a norm in our life. Like that's just go in the exam and say, अगर मैं fail हुआ तो सब fail होगा.
Positive सोचना बहुत जरूरी है.
Yeah. Exactly. All the best.
Thanks.
Thank you, sir. Thank
The
you. Thank you,
discussion
sir.
can
Thank you.
continue. Any questions, queries you have, we can do it on the group.
Sure, ma'am. Please do share the videos.
Thank you.
You want?
Thank you, ma'am. Thank you, everyone.
Thank
All
you.
the best.
I told that you'll be sharing a video of this.
Keyword approach. I will send you. There's a video on YouTube. I will send. I will share a link to that.
Okay.
Okay.
Thank you.
Thank you.